Hello, and a very warm welcome to this afternoon's Royal College of Psychiatrists free members webinar on applying for specialist training in psychiatry. I'm delighted that we've got a fantastic expert panel this afternoon who are here to give you information and feedback about their own experiences of higher training. During the course of the afternoon, we really encourage you to ask questions and to put those in the Q&A box rather than the chat box, please. We'll be trying to answer as many as we can during the live session. And then at the end of the speakers' presentations, we'll put as many of your questions as we can to the speakers to answer live. So first of all, I'd like to introduce our first two speakers. Janine Chesters is the Deputy National Recruitment Manager for Psychiatry at Health Education England North West, who administer the entire national recruitment programme for Scotland, Wales and England. And she's joined by Professor Nandini Chakraborty, who is our national recruitment lead. And that's a joint post between the Royal College of Psychiatrists and Health Education England. So Janine, over to you.
Okay, so I'll just run through some slides with you. Okay, so 2022 recruitment.
Hi Kate, we're not able to see your slides just yet.
Can you see my slides?
Not just yet, Janine. Sorry, Janine, we can't see your
Sorry.
slides just yet.
Bear with me a second. Can you see those now?
Perfect, thank you.
Lovely. Okay, so I'll run through the process for applying to ST4 Psychiatry for the August 2022 intake. Recruitment to ST4 Psychiatry for the August 2022 intake will be the same process as it was for the August 21 and February 2022 intake. It's based on the previous face-to-face interview framework. You are only required to complete a single application, regardless of which subspecialty you wish to apply for. All ST4 psychiatry posts in England, Scotland and Wales across the 6 single specialties and 7 dual specialties will be available for you to preference from the 21st of March 2022. There are 3 elements to the selection process: a verified self-assessment score, online generic interview, and an adjusted CAS score. You can apply to ST4 Psychiatry without holding full MRC Psych. However, we will go into more detail later on in the presentation on this. No distinctions can be made between those that are currently on the UK Core Psychiatry Training Programme. Anticipated posts. So as previously mentioned, it's a single application for all higher psychiatry training posts in England, Scotland and Wales. There are usually more posts than applicants. However, certain specialties and locations are more competitive than others. A list of indicative vacancies can be found on our webpage. However, please note that these numbers can change and extra or new posts can be included in the recruitment cycle at any point. Listed on screen is a full list of subspecialties that you will be able to preference. Eligibility requirements. Applicants need to be on track to have 36 months experience in psychiatry by August 2022. You can count previous experience in broad-based training or via the accreditation of transfer of competence framework. More information can be found in the applicant's guide, which is located on our webpage. Applicants must be able to demonstrate core psychiatry training competencies by the anticipated start date. Core competence can be demonstrated in the following ways. If you're currently on a UK Core Psychiatry Training Programme, you must be able to provide your NTN or DRN in your application form. If you have previously completed a UK core psychiatry training programme, you will need to provide a copy of your CT3 ARCP for completion of core training as evidence. ARCPs that have exams or psychotherapy outstanding can be accepted, but you must upload supporting evidence in your application that demonstrates these have now been achieved. If neither of the above apply, you must ask your supervisor to sign off a Certificate C, which demonstrates equivalence to core psychiatry, and attach it to your application form as evidence. The Certificate C and guidance on how to complete this can also be found on our website. You must hold full MRC Psych by the start date of the post. MRC Psych and eligibility. You can apply to ST4 Psychiatry without having full MRC Psych. However, you cannot start in post without holding full MRC Psych. If you do not currently have CASC, then you will need to confirm to us that you will be sitting CASC in the January 22 diet via the application form. If you do not currently have paper A, the next diet for this will be in December 21, or paper B, for which the next diet is March 22. Then again, you will need to confirm this to us in your application form that you have registered to sit those papers in those particular diets. If you're sitting paper A or paper B in December or March, any offer of a training post you receive will be made subject to you passing paper A and or paper B. All invites to interviews will be sent out in January 22. How to apply. All applications must be submitted via Oriel. This is the newer version of Oriel which came into effect from November 2020. You will need to ensure that you've registered for an account on this version before you can submit an application. Any old Oriel accounts will not be active. You must apply between 10 AM on Thursday the 18th of November and 4 PM on Thursday the 9th of December 2021 UK time. Please aim to submit your application well before the closing date, as late or incomplete applications will not be accepted. Online application. The application form will ask you for personal information, qualification and employment details, including your MRC Psych status, referee details, your self-assessment scores. Please ensure you do complete this section. There are no white space box questions. Depending on your circumstances, you may need to provide supporting information. The application form should prompt you if you need to attach any evidence. Your application will be longlisted to check that you meet the relevant entry criteria. It will not be shortlisted. During the longlisting period, you may be contacted by the Psychiatry National Recruitment Office via the Oriel system to provide further information or evidence. Please ensure you regularly check your Oriel account for updates. Any miscommunication could result in your application being rejected. At the end of the longlisting process, all eligible applicants will receive a message to their accounts via email to confirm their application has been successfully longlisted. I'll just hand you over to Dr. Chakrabarti now. He'll carry on with the presentation.
Okay, there we are. Thank you so much, Janine, for that introduction. And hello, everybody. Looking at the selection process in a bit more of detail, we have 3 sections. The verified self-assessment score. So you score yourself first on documents that you upload to the 10 domains of a portfolio section within the application. And these are verified by assessors who are consultant psychiatrists. You have an online interview, which carries 32.5% of marks, and the CASC exam score is 50%. Now, to be clear, there's no minimum score for the verified self-assessment, and there's no minimum score for the CASC. You will have to score 50% to pass CASC anyways. So the only section where you could score less enough to be unappointable is the online interview. But that happens very, very rarely. Most candidates at this stage, in our experience, are appointable and will get offers of posts if you are flexible with your choices. Next slide, please. So these are your self-assessment domains, domains 1 to 10, and there is more detailed guidance on the Health Education England website when you do your application there. We have very, very specific pointers for every domain on how many documents you should upload to the maximum, what kind of documents, what kind of evidence we are looking for, and it is really important that you stick to that guidance. It is very tempting to try and put your CV or other lists of things which you think might impress the verifiers, but that is not going to happen. Within domains 1 to 10, most of the domains are not time limited. So anytime in your medical career, if you have done these things, you can upload the evidence, excepting domains 5, 6, and 10 highlighted over there, which are limited to 7, 6, and 6 working years. What it means is that is whole time equivalent. In the past, if you have worked part-time or had career breaks, then the chronological time obviously stretches. So if you have had the career break or less than full time, you need to upload that evidence as well so that we can match the timing of your evidence as having been within the appropriate time frame we are looking for. There is a reason why these domains are time limited, and that is to be fair to all candidates. Some candidates can produce more evidence just by being in the system for longer. And we don't want to disadvantage junior candidates who might not have been in their medical career for shorter periods of time, but can still produce quality evidence even though they don't have the numbers. So that's the reason why those particular domains are time limited. Next slide, please. This is just an example. So let's say for domain 6, which is clinical governance, audit, quality improvement, this is the kind of evidence that we are looking for. So for a score of 5, which is the maximum score, it says that you've got to complete a quality improvement project or a complete audit cycle and show that it has resulted in national change. And the evidence that we require over there is, again, it's given over there. It's a PowerPoint presentation that covers the audit, the action plan, the evaluation, the quantification of the audit, and the evidence that it has been led by yourself. And it has the dates as well, obviously. So the full guidance will tell you how many pieces of evidence you can put in over there. But the point is, if you qualify for this section for a national audit which has brought national change, then there's no point giving multiple local audits as well, because that doesn't give you extra credit. If you've done something on a national level, you get score of 5, and that is where it should rest. Next slide, please. Now, the scores that you award yourself will be verified, and that's why it is verified self-assessment. We do not take what you have given us at face value. We will check and verify that they go according to the guidelines. You should score yourself as accurately as you think, and a few points over there. Some mistakes we find trainees making is that they put their scores, forget to upload the evidence, or they have uploaded the evidence and there's been a technical problem and they have not realized that the evidence has not been uploaded at all. If we do not find any evidence uploaded, the documents uploaded, you get a score of 0. You will not get any marks, whatever descriptors you might have put in. And it is worth going back into the portal and double checking that your uploaded documents are there. Sometimes we get people telling us that, look, I did upload, I've got the screenshot of it. You must have missed submitting, putting a last button, clicking a last button over there for the reason those changes have not been properly saved. So please, please do go back and double check. If you are scoring yourself anything above 0 in a domain, it should be supported by documents. And please do not leave it till the last minute. If you are uploading documents, at 5 minutes to 4 on the 9th of December and your computer crashes or everybody's trying to do it at the same time, you will lose an opportunity. Also remember, 9th of December, 4 p.m. is your deadline, and this 4 p.m. is UK 4 p.m. So if we have people here on, who are overseas, then you adjust your timing according to the UK time for, what you can, for the deadline that you have. Make it easy for the assessors to interpret your evidence, which means that we have to see your actual involvement. There's no point giving us a document if it doesn't have your name on it. How do I link that evidence to you? Or there's no point giving us your CV. A CV is a Word document, it's a PDF document, it's not an evidence of anything. And always go for quality over quantity. I have seen people put on evidence, but they've put on too much, and the evidence which was low quality has gone on the top of the list. And if you go above the maximum number of documents you are allowed, we will just see the maximum number of documents you have, that you are allowed, and we will not look at anything beneath it. So the last thing you want is that you have quality evidence, but because you've put on too much, the quality evidence gets lost below the non-quality evidence. And there's an example over here. If you are first author in 10 peer-reviewed publications as a postgraduate, pick the ones that you are most proud of. Pick the ones where you are first author and put those two and those two only. You get marks for anything above one publication. So there's no point giving your entire list and running the risk that the actual quality one is going to be missed. Next slide, please. The online interview is a 15-minute interview over MS Teams. There are 2 assessors. Usually it'll be one assessor asking you the questions on one scenario, and then it might be, the two interchange, or there'll be one assessor who asks you both, but they will both mark you. And that is to be fair, to bring objectivity into the process. They will give you marks without conferring with each other in the first instance. There might be a lay representative observing over there. The 2 scenarios are published in advance of the interviews. It's the same scenarios we have been using in the last couple of rounds. There has been no changes over there. Please do not give us a 6-minute spiel. This is important. We want a conversation. We want to see your senior thinking. We want to see how you approach a conversation with another colleague, a consultant. And so let your interviewers ask you those probing questions. You are not being marked like a cask scenario in that this is a pass fail and you have to go through some specific points. There is no right or absolutely wrong approach to it. It has to be a sensible approach. We want to see that senior thinking, and we want to see a conversation. Next slide, please. The adjusted CASC score. So what this means is, yes, your CASC scores are important. They carry 50% of marks of what you are being ranked against. But in order to make it fair on different cohorts, if there was a time when the pass mark was quite low, it might have been seen as a more difficult diet, that pass mark is still set at 50%. And let's say there was another diet where the pass mark went up to hypothetically 62.2% or even 70%, whatever. The adjusted score for the pass mark would still be 50%. So let's say you were in diet X and the pass mark was 50% and you got 50%, that's your mark. But let's say in diet Y, the pass mark was 62% and you got just a pass, your mark would still be 50%. So that is trying to make the diets comparable and fair, so that if there was a particular time when the marks went very high, it's not that that particular diet is at an advantage and the others at a disadvantage. If you have your CASC score at the time of application, you will need to upload it. But if you're sitting CASC in January coming, we will ask you to provide proof of passing later on. So the point is that we want the eligibility criteria fulfilled, before you are, starting your rotation. Before we give you the choices, we want to see that you have passed your CASC in January, because that is going to be the time that you have. Yes, we wouldn't ask for your CASC score straight away if you are due to sit your exam in January. Next slide, please. The applicants will have the opportunity to rank all available posts in order of preference from 21st of March 2022. So that's the time when we would have finished our our assessments, and the initial offers will be made in the week commencing 11th of April. Now, this is the point where I say, please be flexible. Use your entire number of choices, think carefully about areas and geographical areas and the specialties that you want to take. You can accept, decline, or hold your offer. The whole deadline is 1 p.m. on Tuesday, 3rd May 2022. So by then you've got to make a decision of whether you're accepting or not. After initial offers are made, they will be recycled every 48 hours. So higher ranking candidates get their offers first. For anything that they might have put forward as a choice and not taken on, then the offers get recycled as we work down the ranking list. If you reject an offer, it does not have a bearing on any future applications. If you change your mind in future and go for a geographical place and specialty, which you might have refused in the past, that has absolutely no bearing. It won't be held against you. If you want to defer the start date, it can be done so only on statutory grounds. So we are talking about sick leave, paternity or maternity leave. You cannot defer simply because you want a career break by choice. Next slide, please. These are the key dates. So you've got the application window, which is already started. The deadline, 9th of December, 4 p.m. UK time. The self-assessment window will, upload window starts between 21st of February and Friday, 4th of March. So this upload time is also important for your documents. Again, you don't want to leave it till the end. Try and do it in the earlier part of that window rather than before. Your interviews are going to be in the first week and second week of February. Then the preferencing window starts on the 21st of March, finishes on the Friday, 8th of April, and preferences reopen between offers of cycle. So keep your eye on the website, keep up to date with what's going on. Initial offers 11th of April, anticipated start date 3rd of August 2022. Next slide, please. And that's it from my end. Thank you very much.
Great. Well, thank you, Nandini and Janine, for a really comprehensive overview of the application process. I'm going to hand us on now to Dr. Rosemary Gordon. Rosemary is an ST4 in general adult psychiatry in the South West Scotland rotation, and she's importantly the chair of the Psychiatric Trainees Committee, and she's going to talk to us about higher training and the PTC. So Rosemary, over to you.
Thanks very much, Dr. Lovett. So I'm just trying to share my screen, which hopefully everybody can see.
That's perfect, thank you.
So as Dr. Lovett said, I'm Rosemary and I am the chair of the Psychiatric Trainees Committee, and I am going to spend the next kind of 10 minutes talking about higher training and how we can help you to improve your training. So we've already kind of spoken about the application process in some detail, so I'm not going to reiterate that. So I'm going to kind of skip through a couple of these slides. So higher training options. So there's 6 main specialities within psychiatry that you can do. So they're general adult, forensic psychiatry, intellectual disability psychiatry, child and adolescent mental health, old age, medical psychotherapy, and dual training. So dual training is the opportunity to have a CTT in 2 separate specialities, and these vary kind of across the country about what is available, so look out for those posts. So what about endorsements? So some specialities allow you to undertake an endorsement in a subspeciality. So people who train in general adult can subspecialise in rehabilitation psychiatry, in substance misuse psychiatry, or in liaison psychiatry. And you do this by completing a year in one of those subspecialities, and that is full-time equivalent. Trainees in older adult psychiatry can also complete an endorsement in liaison. So one of my favourite things about higher training is special interest time, and it's something that really is specific to higher training in psychiatry. My friends doing things like medicine don't get this time, so it's something that I think we should all use to the best of our abilities. So this is a day a week where you do something outside of your normal clinical job. So I currently use my time to do PTC work, but there's lots and lots of options that you can choose from, both clinical and non-clinical. So I'm going to talk a little bit about that. So you can do some postgraduate training, or you could do some psychotherapy, you could get involved in education, leadership and management, do some quality improvement, a bit of research and audit, or you can do something clinical. So I'm just going to briefly discuss each of these. So you might choose to do some postgraduate training, and actually there's lots of different options. For example, some trainees might do an MBA or perhaps postgraduate diploma in education. Postgraduate training can be expensive, so look out for some funding opportunities, and they are available. As a higher trainee, you do need to undertake some psychotherapy experience each year, and you need work-based assessments in these, but you might want to do a wee bit more. And again, there's lots of options. You could do some reflective practice, you could join a Balint group, you could become a Balint group supervisor. There's lots of patient groups, short cases, long cases, or teach some medical students some psychotherapy. Again, within your higher training, everybody needs to be involved in education, and it's part of the curriculum. But again, you can use your special interest time to further develop these skills. Why not do some medical student teaching, organise the local MRC Psych course, become an OSCE examiner, get involved in your local university? I think education is very valuable and rewarding, and we'd really encourage you to think about using your special interest time for this at some point during your higher training. Developing your leadership and management skills are really important. And again, there's lots of opportunities to develop these, both in a formal and an informal setting. But you can use your special interest time for this as well. Why not complete a leadership programme or join a committee? Personally, I'm going to tell you to join the PTC. I think everybody should have it done at the PTC at some point. It's absolutely fun and great. Research, audit, QI. You know, find something that interests you and do a bit of research, do a bit of QI or do a bit of audit. Most places will have a head of research and a QI lead, so get in touch with them and I'm sure they'll be able to find you something that you can get involved in. And you know, don't forget the clinical options. There are lots of different clinical options that you might not get to do in your day-to-day practice. Why not do some special interest time in ECT, or a psychodermatology clinic, substance misuse clinic, or some perinatal? You can even think outside the box of psychiatry. You could go and work on a old age ward for some of that time, or perhaps go and do some neurology clinics. There are so many different options, and my one piece of advice is to get out of your special interest time what you want. Like I said, it's a great opportunity and one that really is only available in higher training in psychiatry. So this slide tells you why I love psychiatry, but why do I love higher training? I love higher training because I get to take more responsibility. I have more responsibility than I did as a core trainee, and I get to learn how to be consultant. And I have that time to learn those skills that are less about the clinical stuff. And I get that time to learn. I get that time to do my special interest time sessions, and I get my supervision. I also enjoy that responsibility. And so far, higher training is my favourite part of training. And I can say that having done GP training for psychiatry training. So I've done a lot of training. So I'm quickly going to talk about the Psychiatric Trainees Committee, which I hope most of you will have heard of, and certainly by the end of my talk, I hope you'll have a little bit more of an understanding of. So who are the PTC and what do we do? So we are a group of trainees who are elected from across the 4 nations. So we sit from about 39 trainees, but we also have a military trainee rep, a foundation trainee rep, a medical student trainee rep, an international medical graduate, somebody on the exam subcommittee, and the editor of our PTC magazine, The Registrar. Each division and devolved nation have 3 reps, apart from Scotland and London, who both have 6 due to the number of trainees that they represent. And we really are here to represent trainees within the college and the external committees, such as the Academy of Medical Oral Colleges and the BMA. We want to drive improvements in psychiatry training and encourage recruitment and retention within psychiatry, and to support trainees through their training. We really are here for you. One thing that I love about the PTC is the fact that within the college structure, we are everywhere. We get invited to all the committees, and there's one of us that sits on pretty much every committee within the college, including council, special interest group, faculty committees, college divisions, and devolved nations. Trainees are the future of the college, and like I said, I really want everybody to know who we are, and for them really to be the heart of the work that the college does. This is a big year for training, and we've got the new curriculum and lots of portfolio changes happening, with our new ST1s and ST4s in February, and then for everybody else come August. We really want to engage with trainees. We've had our 2 years now of national CT and ST welcome events. We've had trainee focus webinars and our trainee conference. And our next trainee conference, Mind the Gap, will be happening in May in London. And I hope to see as many of you there as possible. We want to collaborate within other committees in the college to ensure that trainees are considered in all the work that the college undertakes. So I've talked a bit about how we do things, what the PTC have done, and how it affects trainees. So I want to talk a little bit about what we've done recently. So fundamentally, the PTC is about improving training. So we're involved in lots of conversations about training, which includes exams, RCP and training issues, the e-portfolio, and recruitment. So I spend a lot of time with Nandini and her team talking about recruitment. We organise conferences and events that are specific for trainees. This includes the Trainees Conference, the Foundation Conference, International Congress, where we have daily events, and hopefully when we're back in person, we'll get to see some of you there. We also have a fantastic social night. We've had the welcome events and trainee webinars. We have some regular publications, including our 3 times a year Registrar magazine. And if you want to get anything published in that, if you could email it to the PTC support email address. We also have a newsletter every 2 months, and I know that everybody gets hundreds of emails, and I am probably the world's worst at deleting stuff without really reading them. But if you only read one email, I urge it to be the trainees newsletter. It's got lots and lots of important information about training, about exams, about recruitment, and about opportunities. So things that might help you get some of those points in your applications, about prizes, about opportunities for research and for publications. So we've produced a number of trainee-specific documents over the last few years, and there's a list of them there. So things like the foster training document, our PSS leaflets on parenthood, our psychotherapy survey, which looks at psychotherapy opportunities across the UK, a guide to QI, our wellbeing podcast, which we've published 3 of them, and we've got 3 more coming up soon. If you haven't listened to them, I would really urge you to do so. They are absolutely incredible, and thank you to Dr. Siobhan Mathican for all her hard work on those. We've got a trainee's guide to mentoring, our other Staying Well leaflets, and Supported and Valued from a few years ago. Other than seeing patients, the PTC is one of the favourite parts of my job, and I do encourage you to look out for opportunities to join the PTC. But you don't need to be a PTC rep to help improve training. We can only make the changes if we hear from you. So please get to know your local reps, feedback to us, and keep up to date with the work that we do. And you're always welcome to get in touch with us. So there's a PTC email address, and myself, my Vice Chair, and Secretary Sharon and Ollie are all happy to be contacted via email as well. And I'll hand you back to Dr. Lovett.
Lovely. Well, thank you, Rosemary. And I think the key messages there are that the Psychiatric Trainees Committee is very vibrant, very engaged with the work of the college, which is very influential in training and continual improvement. So the message to get involved when you become a higher trainee, real good opportunity there. So our next speaker is Dr. Alex McDermott, and Alex is an ST4 in forensic psychiatry, although as we know other specialties are available, another 5 of them, and various dual combinations which we've heard about, and I think in the Q&A will come to think about other subspecialties in psychiatry which don't yet have endorsement. But Alex is training in South Wales, and he's going to talk to us about his experience of applying for ST4 training. Alex, over to you.
Hi, thank you, Dr. Lovett. So if I just share my screen. Hi, can you see that?
Perfect.
Great. So yes, my name is Alex McDermott. I'm a ST4 forensic psychiatrist based in South Wales. I'm also a PTC representative for one of the PTC representatives for Wales. And I'd like to talk to this today as, although I didn't get the best score myself, I think there's some things that were important to reflect on. And I think that just to reassure a lot of people that even if the score isn't the best in the world, you may still be able to get your dream job, basically. So reasons to not be afraid, which is, I think, is very important to realize. Please don't panic. This stuff really, I find quite difficult, and I find all the applications and all the external stress quite difficult, to be honest. So important things to remember, this isn't hugely dissimilar to core training. It's something that most people will have done before, and you've got nothing to lose. You can see this as a practice run in order to assess the process going forward. And that was kind of the attitude I tried to take going into this. I feel a small amount of preparation could go a long way with this. I mean, there's a lot that you will realize that you haven't done, and that, that you have done, over the past few years that you maybe didn't think would score you points, but that can be hugely helpful. I would recommend having the ST4 recruitment website saved in your favorites. It's got a huge amount of information. Everything there I found to be very helpful, and most questions are answered by that. So I won't go over this, but I would just say have this printed on your fridge, have it on your favorites in your hard drive, know where things are. So some important dates, I suppose, are the self uploading evidence for the self-assessment verification, which are important to remember to do that as well. We talked about this earlier, so we'll skip over that. But my attitude to the CASC is you've already got it in the bag, and okay, so some of you may not have, and if you're applying in January, obviously this should be your focus and your priority. But 50% of what's gone on already, you can't change. So in some ways, that's kind of reassuring. I think the CASC is hugely different to the interview, but the skills you've got there and the skills you've had of talking to colleagues and patients over the past few years, you're just showing these off. And I think the interview is an opportunity to do that. So the CASC skills will help out there. Remember to use the same email for everything, because I slightly didn't with mine, and that led to some very panicking emails. So remember to use the same email account for all the process that you go through. So the self-assessment, in my view, it takes up a lot of time and worry compared to the amount of score it is. And I think that, just see it as an opportunity to show the extra work that you have done over the past 3 years. If you're unsure about categories, just try and be as honest as possible. I think some people get quite scared about putting the right thing down, to be honest. And there's some things at this point that, you may not be able to get, but there's lots of other things that you may be able to even get in the short time available. And there definitely is some low-hanging fruit. So I think lots of people may have done teaching and not really realized it. I think that's something that I definitely found, and I attended a teaching course, and I didn't even know at the time that it was going to be relevant for this. But so there's maybe several things you've done that you didn't realize until the time. So and any teaching you've done, really, a lot of it can even score you a 2. Poster presentations, there's lots of these going around the Royal College. There's loads of different events, and there's loads of opportunities, both regionally and nationally. So this in a way is possible to get, and I think a lot of people don't realize that, or it's not something they thought about up until this point. So yeah, that was something I managed to use as something that really helped me was a presentation from a few years ago. Other things that I found, helped with my self-assessment score, the QI project. I imagine most people will have been able to do something locally. So even if it's a bit intimidating getting the 5, I think you can definitely, a lot of people can be able to, as long as you've demonstrated change and you're able to get the various sign-off from the QI or audit lead, I think most people will have done something like this. So I think the thing about the self-assessment is to not panic. You will have done lots of things, and I found I'd done a lot more than I expected. So the interview, the questions are released beforehand. I think maybe I slightly over practiced, and I think it's possible to do that. It is a bit different from the CASC. It's just a more general thing. Book the time off well in advance. Don't try and say too much. I think these questions, when they come out, you'll see that they're really interesting, actually. You can write a whole essay on some of these topics, but less is more. Try and get the key points. Try and say what's different about you as a trainee. That's what people want to know about. I was post night shifts, so I'd recommend, obviously not always possible, but trying to have some time beforehand, set up your room well, get yourself in the correct kind of space for that. So I mean, in terms of ranking preferences, it's similar to core training. Just put where you would like to work first. There's no kind of game to it. It's just what you would feel you'd do want to do the most, really. I would be remiss here if I didn't mention that Wales is a fantastic place to train, work and live, as per our Hugh Dunstall, who's an intellectual disability trainee here, right next to the beaches, right next to the office. But I think wherever you're going, I think ST4 is a fantastic experience. It's regarded as the highlight of many people's career, and I'm saying that quite genuinely. I'm not, I think that definitely is what a lot of people tell me. You're in the subspecialty of your choice now. It's the thing you wanted to do, and it's only 3 years away from having that consultant post. You may well be somewhat supernumerary, which is a little bit different from some of the core training. The special interest time, as Rosemary talked about, is really so important. There's loads of opportunities for research and extra things. So these are just out of people I've spoken to, what things have they found the special interest time they've done. I'm doing a medical education course. There's lots and lots of people doing research, and I think the attitude to research changes in ST4, and those things become a lot more available, and that there'll be people more out there, wanting to find ST4 trainees because they're helpful for that research. Interest in other subspecialties. You could do a law degree, leadership, management. There's loads are going on. I even know some people are doing Welsh lessons. And of course, joining the Psychiatric Trainees Committee is a fantastic thing I recommend as well. So yes, this is just my opinions, but I think ST4 is a lot better than core training. I think that is a really difficult hump to get through. And, over the past 3 years have been a really difficult time. And some people have I think it's kind of a reward in a way, getting to ST4. I think now is a good time to apply because there may be more people later on. It certainly seems to me easier than the CSER route from what I've seen. The special interest is really valued and protected, and there's a huge variety of things of what you can do. That being said, if it doesn't quite work out this year, there's always next time. Although I don't think the training alternatives are quite as good in my opinion. So that's kind of my experience and opinions. And I think you've done most of the work already. You've got most things there. It's just putting it all together and showing that you can do it. So thanks very much.
Great, thanks, Alex. That was a fantastic presentation, and I'm sure will be hugely reassuring to many people in the audience. So now we have the opportunity to put some of your questions to the panel, and we've been working, or the team have been working very hard behind the scenes to answer your questions live as we've gone along. So I'm going to start off. Well, we've got 2 unanswered questions here. One is a comment. I think that's really interesting, isn't it? So this is from presuming a consultant colleague saying, "Glad I'm so old. Were we worst clinicians without all of this?" Well, I guess the way that we apply for jobs is very different from how it was in the past, and that's for many good reasons, I guess. It's not just within medicine, it's throughout the whole of society. And when I look at my kids and what they have to do to apply for jobs, it really is very different. We've kind of moved away from the smoke-filled rooms that were in our days. So I think, you know, times are different, and we are where we are. But I'm going to move on to ask the question to the panel. This one, would it matter if my supervisor has retired and can corroborate my evidence for competency? Maybe if we could go to Nandini and Janine to answer that one. What happens if the one person on the planet that can corroborate the evidence has retired? How would we deal with that?
I think it's not about, you know, retirement or not. It's about the time period in which the consultant has observed the trainee. So it couldn't have been somebody who was in post 20 years ago. I'm just talking hypothetically. Janine will know the time period better, but I think it's at somebody who has observed you for at least 3 months in the last 3.5 years. So as long as that criteria is fulfilled, I think we're okay with retired people.
Retired, as long as they still have a license to practice, that'll be the main thing that we'd be looking for. So yeah, as long as they still got a license to practice on the GMC register, then they're fine to sign off as certificate C.
Fantastic, thank you. And there's a question here from Nudra Rivsi, who's saying, if coming from non-UK training after passing the membership, how much time is required in training in CAMS, old age and adult? So presumably that's for signing off the certificate C. I don't know if either of you want to answer that one.
Actually, I've put it, I have typed the answer, and the point is that it's not a time limit of you've got to do 6 months here and 6 months in every post. It is about knowing that you have the competencies. So it ultimately depends on the sign off of your certificate C. And if the person signing off is happy to say that you have the competencies as per the curriculum in different specialties as we would expect at core training level.
Yeah, and they do need to have a minimum of 36 months experience in psychiatry. It doesn't matter which subspecialty that's in, it just needs to be 36 months in psychiatry.
Great, thank you. So there was a question, I think, earlier on, and which was partly answered, I think, about training in perinatal psychiatry. And I don't know whether at this stage it's just worth running through the different specialties in psychiatry, the subspecialties, and then just having a think about the other, you know, expert areas in psychiatry, but for which there isn't a formal training program at the moment. I wonder, Nandini, do you want to talk through that, or I mean, I'm happy to do that.
What was the exact question?
Yeah, so this was a question about would it be possible to gain an endorsement in perinatal psychiatry? So I think the quick answer is that the college is in the process of developing what's called a credential, but at the moment there isn't a formal route for training in perinatal psychiatry other than undertaking general adult psychiatry training and trying to gain some experience during the rotation. There isn't a specific way of signing you off in that subspecialty. And that's the same for eating disorders and neuropsychiatry. So we'd really encourage people to train in those areas, but that's by usually taking a general adult pathway and gaining appropriate experience on the way. The subspecialties that are endorsed in general adult psychiatry are in rehabilitation psychiatry and addiction psychiatry and liaison psychiatry. and that is by spending a year in each of those subspecialties. And that means that at the end, when you get your CCT, you have an entry on the specialist register saying that you have an endorsement in one of those specific areas. And the other endorsement that you can get is if you're an old age psychiatry trainee and you spend a year in liaison psychiatry, you can get an endorsement in liaison as appropriate to old age psychiatry as well. So yeah, I just thought it would be helpful to flesh that out a little bit. We've had another question here, or a comment from Maria Moisen, who's saying, regarding the interview, I sat the interview twice with exactly the same scenarios, 2 different panels, had the same preparation, and the second time I was scored several points less. And that's worrying, I think. Again, Nandini, I mean, I suppose, you know, people's performance may differ between interviews. I don't know if you wanted to say something about that.
It would be quite difficult to have exactly the same performance, because what we are looking for, as I said, is not a spiel, but it is an exchange with the probes that we offer to our interviewers and carry on a conversation. The conversation follows what is started off by the trainee, by the applicant, but then it follows through with probes from the interviewer. So it's pretty difficult, I would say, to absolutely replicate the same performance and the same conversation in both rooms is my feeling. I'm really sorry that you feel that way. But, you know, yes, we know that, you know, there can be a degree of subjectivity. I'm not denying that. I think that it would be, you know, hypocritical to deny that. But every time we do train our interviewers to be as, you know, objective as possible, they do independent scoring. And actually, our psychometric analysis after the rounds show that we are giving valid and reliable scores. So in terms of our statistical analysis, our procedures are robust at the moment. So that's the only reassurance I could offer.
Great, thanks, Nandini. There's a question here, I think, just going back to endorsement, about can you get more than one endorsement. I think that we, you know, encourage people to focus on the sort of the specialty that they're doing, and that you'd normally get one endorsement within the training, and heads of school and training program directors would be dissuading people from you know, doing more than one subspecialty job. It's really important that you get the core, the basic sort of heart of the specialties that you're doing. There've been a couple of questions about the process in Northern Ireland, and I think it's important just to point out that this webinar refers to the process of application if you're in Scotland, England and Wales, and there's a different process in Northern Ireland. So we would refer you to the Medical and Dental Training Authority there. And I think there's a link both on the National Recruitment website and college website as well. You don't need to be in those countries, but if you're applying for training in Scotland, England and Wales, this is a process that we've been talking about this afternoon. There's a question here from Hebda Radwan about not sure what the evidence for research can be. Can you count a master's degree from overseas? Janine, do you want to answer that one?
Yeah, just bear with me. You can. What we would always say, we can't advise you what to upload into your self-assessment portal, because it is a self-assessment. What we will say is any evidence that has been uploaded will get assessed by a clinical verifier. If the evidence you provided doesn't meet the criteria, your scores will get adjusted downwards. However, if it does, if you've underscored yourself, then your scores will also get readjusted with a higher mark. Any scores that you don't agree with, there is an appeals process, and then it'll go to the clinical leads on the National Recruitment Board, who will then reassess that information, and then they'll either uphold or reject the appeal. But there will be some self-assessment guidance on our webpage in the coming weeks, and it does give very clear, detailed advice what is accepted and what we would recommend you upload to score that particular mark for that domain.
Brilliant, thanks Janine, and I guess that's the official answer, because people can't advise you what to put in from HE Northwest, but I think as somebody outside of that process, if you've got a master's degree, it doesn't really matter which university it's from, and if it's relevant to research, yes, absolutely use it, and nobody's going to say it has to be a UK degree. We're an international specialty, and use all your experience and be very proud of what you've achieved, and also think creatively. As Alex said before, the likelihood is that you've got absolutely masses of stuff that you can put in your application. Anybody who's been through training program will have had lots of experience that will tick many of the boxes on the application.
If I could just add to that, Kate, I was looking at the guidance at the moment, and as Janine said, it's very clearly specified. A PhD comes at the highest score of 6, and recruiting participants into a research project comes at the lowest score of 1. And in between, there are various grades right from 6 to 1, which are very, very explicitly detailed. As far as I can see, a master's degree on its own is not what we are looking for, but if there is a research project involved, we want to see evidence of the research project itself. Great. But a PhD certificate itself is score of 6.
Okay, great. Thanks for clarifying that. That's great. I think we've probably got time for one more question, and that's about commitment to specialty, and again I'm going to go to Nandini for that, and it's a question about how do we prove commitment to specialty, and does it still matter, and a comment about experience in psychiatry and how you demonstrate that on your application, because there are many people applying who've got extensive experience, possibly as specialty doctors and so on. So how do the panel assess commitment? Nandini.
I think that the verified self-assessment scores, the 10 domains, give ample opportunity for people to demonstrate what they have been doing in their time in psychiatry. It's not just about being present in psychiatry. We are looking at that active presence, the projects that people take on. How do you prove your interest in psychiatry over and above just, having a job description? And we hope that for people who have been in psychiatry for long, they would have the documents to prove that in those 10 domains in various skills and areas that we are looking at. Yes, one of the criticisms we have faced at this point is that we don't allow specialty specific commitment to be shown. It's the one application, everybody gets marks, they are ranked accordingly, and then the person higher on the rank gets their choice of specialty and geography first, and then that's how we work down the ranks. And it just stands that there are certain specialties in certain areas which are of more demand, and the more you score, the higher ranking candidates get the first say of how they get into that. There isn't a perfect answer, but
great. Well, thanks, Nandini, and we're out of time, so it just remains with me to say Thank you to all our speakers this afternoon. Good luck with the training, and as Nandini said, you know, get your applications in soon. Don't leave it to the last minute. I think there are 2 weekends between now and the closing date. So good luck, everyone, and hope to see you in the future in your careers as higher trainees. Have a good evening.